this wonderful time of year, the season of pumpkin patches, football, and hay rides, but also hay fever. So, for those of you who are like me, allergy sufferers, this can be a potentially miserable time of year. And we just struggled through talking like this and acting like we're enjoying ourselves when we really can't breathe and are struggling to do anything. So let's talk about some productive things that we can do to help make it more pleasant during this allergy season.
And winter is coming.
Most allergy sufferers already know the symptoms, but for those of you who don't, boo-hoo! I'm sure you probably have something else, but it must be tiring just being perfect. Okay, so itchy, watery eyes, runny nose, sneezing. Sometimes people will have a cough that won't go away. Just lots of different things can set you off too. So what are things that we can do? One, avoid the triggers when possible. If you know that you are allergic to pollen, maybe you shouldn't jump in a nice big pile of leaves that somebody has raked up. There's lots of stuff in there that can get stirred up. Don't sleep with your windows open. I know a lot of people like to do that in the fall because it's so nice and crisp outside, but there's also lots of yucky stuff outside that wants to get in and cling to your mucous membrane, and it's no good. Make sure that you keep your house dusted and sweep your floors frequently. Change your sheets often. Change them awesome too, that's fine. But they have allergy reducing mattress covers and pillow covers that you can get that can really help reduce what gets left in your bed things. If you don't already know this, you're about to get a little peek into my house. Not actually, but if you did, you'd be kind of bored because I don't have stuff around the windows, because window dressings are a great place to trap dust, dander, and other things that cause allergies. So if you do have those, make sure that you're cleaning them when you're dusting and cleaning the rest of your house, because otherwise you're just trapping stuff in there. Carpets too. Get your air ducts and air filters cleaned often. Change them out like you're supposed to. Nobody really does that, but change them more often and you'll feel better for it. One of the things people have started doing in the last 10 or 15 years in the United States, we've taken this from people in Eastern countries, is nasal rinses. If you get the saline, you can use either a neti pot or the squeezy bottle. I like the squeezy bottle because I can control the flow of the water a little bit better, and I'm all about control. Kidding, sort of. But that will help wash the stuff out of your nose, whether it's pollen or snot. Really quite productive on getting things out of there. You can also use a daily antihistamine, something like Zyrtec, Claritin. My preferred is Zysol. The generic is levocetirizine. It can be a prescription, but you can also buy it over the counter. It's a lot less expensive if you get the prescription for the generic. I like it because it doesn't make me drowsy, so I have all my faculties present during the day. There is another type of medicine, leukotriene receptor inhibitor. Singular is the name brand. Montelukast is the generic. You can get that with a prescription, and for some people it really helps quite nicely with their allergies. It works better generally in people who have asthma. If oral medicines aren't working well enough for you, or you don't tolerate them for whatever reason, we have nasal steroid sprays. There's several different ones. Flonase, Nasonex, Nasorel, Nasacort, whatever. They work really well, especially if taken every day. It sometimes takes a few days for them to have their maximum effect. Some people notice immediately. I certainly don't. So it's a good mainstay type medicine. Then we have a different kind of nasal spray that is antihistamines. They tend to work faster. They taste horrible, and so often I just use them as an add-on for people, but they also work for environmental triggers or vasomotor rhinitis, which the nasal steroid sprays really don't work for. There are a couple of nasal sprays that combine steroid and antihistamine, so you get more bang for your buck. Some people prefer those, and everybody would prefer them if their insurance covered them very well, but sometimes that could be an issue. For those who don't respond to any of these things, then it may well be worth going to see an allergist so that you can have allergy testing and potentially get allergy injections. There are also a couple of biologic type medications that can be used. I'll leave that to the allergists though. So arm yourself with a bunch of hankies and get ready to head into the fall. Hopefully we'll make it through together. Don't forget to like and subscribe and stay tuned for more.